Hi, I'm Hasan. I'm Chief Medical and Healthcare Officer at Vitality, and I'm really pleased to be bringing you this week's edition of Clinically Speaking. We're going to be talking about telemedicine and telehealth today, what they are, why its usage is exploding during the pandemic, and why they're here to stay. Firstly, if we think about what they are, the prefix tele refers to something being at a distance. So telemedicine is the provision of healthcare at a distance. There are lots of more technical definitions that have existed to try and either round off or broaden what's included within these terms. People also used to talk about e-health and m-health, and people talk a lot about digital health too. There's a huge amount of overlap within these definitions. The thing to know that's consistent across all of these is that technology use is a key factor, and that patient empowerment is absolutely front and centre of the solutions. Telehealth can replace a huge amount of care that happens in a face-to-face setting. Everything from health promotion and health improvement, to triage and self-management, to primary care, to secondary care, to maintenance of healthcare and recovery. You can't have an examination via telehealth, at least a physical one, but you can use it to have a discussion with a clinician, to assess your symptoms against validated tools and scales, to decide whether you need investigation, and to have follow-up consultations with your clinicians, amongst other use cases. We at Vitality, we're proud to be the first organisation to roll out telemedicine via GP for every single one of our members in 2015, and we're pleased to have maintained and expanded that benefit for members as we've continued over the years. So why has telehealth and telemedicine exploded during the pandemic? If you think about all the factors that have changed behaviours during the pandemic, these really create a perfect storm for telemedicine. Firstly, patients are understandably anxious about going into healthcare facilities, particularly patients with health conditions or who are older who may be shielding. Having telemedicine consultations reduces their risk of exposure in terms of going to an environment where there may be a higher risk of catching COVID. The reduction in risk also works for clinicians as well. The majority of GPs I speak to conduct all or virtually all of their consultations via telephone or video consultation at the moment. The reason they do this is not just to protect the patients, but also to protect themselves and their colleagues too. If someone has chest symptoms and they might be at risk of coronavirus, but they can be safely managed at home, if they continue a consultation in their own home with adequate support from clinicians, it may avoid a trip to hospital where they're at risk of infecting others, including healthcare professionals. What's also changed during the pandemic has been an increasing readiness of regulators and other professional bodies to support telemedicine. Some people in the NHS have described years of change happening in weeks, and with the readiness of uptake of telemedicine solutions, that seemed to be generally a really positive, encouraging trend. So why do we think it's here to stay? Firstly, we think people's behaviours and how they've been affected in the pandemic mean that things are going to change significantly for the future because people find the new way of working and living better. We've seen elements of this in how people are really valuing the opportunity to work from home. We've also seen elements of this in how people choose to engage with healthcare. We've seen with our members, at one point we were having almost triple the baseline amount of calls to our GP advice line service. And that's on top of the fact that video GP consultation rates are up approximately 50% for where they were a year ago. Secondly, we at Vitality have enabled our members to access video consultations with specialists. Typically we were doing very few, if any, of these. However, this has become the predominant way of people consulting with a specialist during the most extreme phases of the pandemic. Finally, if we think about the future ways in which these can bring efficiencies and improvements in outcomes to members, there is a huge amount of opportunity. The convenience factor of being able to consult remotely is strong, but if you add on top of that the accessibility of patient self-management tools which can help people monitor, manage and update their symptoms, we think about some of the benefits in standardization where having access to decision support systems and patient self-management tools can help. And if we think about all the other benefits that technology can bring, there's clearly a great deal more to be done with telemedicine and telehealth to continue getting better in helping people become healthier, having great access to healthcare, and continuing to manage their conditions effectively. We're looking forward to a bright future with telemedicine and telehealth. I'm Hasan, and I've been talking to you about telemedicine and telehealth. Thanks very much for joining me this week.